Knock, knock.
Come in.
Hi, my name is Jessica. I'm going to be your nurse today. Looks like we have to do a physical assessment. Is that okay with you?
Fine.
Okay. Can you please tell me your name and your date of birth?
Austin Crossman, 120299.
Okay, thank you. I'm going to go wash my hands and get everything set up, and then we'll start. At this time, I'm going to do a general survey. He is a male. He is clean and hygienic and groomed appropriate. At this time, can I have you stand up and walk to the chair for me? Thank you. His gait is steady, even, and balanced, and his posture is erect. Do you have any pain at all?
My finger.
Your finger, okay. How long has that been going on for?
Since yesterday.
Since yesterday. How would you kind of describe the pain? Dull, achy, sharp?
Stinging.
Okay. What? Does it radiate?
No.
Okay. Do you have any other symptoms with it that go along?
No.
Okay. How long would you say is it constant throughout the day? Is it
Constant.
constant? Okay. What would you say makes it better?
Nothing.
Okay. What would you say makes it worse?
Washing it.
Okay. On a pain scale 0 to 10, 0 being no pain at all, 10 being the worst pain, where would you rate your pain?
2.
A 2? Okay. Can you please tell me your name and your date of birth again?
Austin Crossman, 120299.
Okay. Do you know where you're at?
My house.
Okay. Do you know the date?
September 14th, 2020.
Okay. Thank you. So here's A&O times 3 to person, place, and time. Okay, now I'm going to assess your head. Look at your eyes, your ears, your nose, and your mouth. That's your ears. Okay. Okay, so his ears are pink and moist with a little cerumen on each side. That's an ear. Okay. There is no skin breakdown on either side of his ear or redness that appears. Open your nose, if you have it. Okay. His nose is pink and moist with no lesions present. Open your mouth and say ah. Thank you. Lift you up. Thank you. Okay. So his mouth is pink and moist, with no lesions present, including his upper and bottom lip. Right. And can you stare up at the ceiling? Look at your eyes. Okay. His eyes are equal, round, reactive to light, bilaterally, indirect and direct. Can I see your eyes real quick? His eyes are 5 millimeters. His sclera is white and his conjunctiva is pink and moist. Next, I would assess his neck. Here, I would look to see if he has any jugular vein distension. At that time, I would raise the head of his bed to a 30-degree angle and remove the pillows. I'm going to turn your head away from me. Thank you. Okay. So he has no jugular vein distension on his left or right side. Now we will feel for his carotid. Turn it to me. Thank you. Okay. Here's a +2 on his carotid pulse on both sides of his neck. Next, we will go down to the lungs. I'm going to listen to this. Watch his respiration. Okay. So his respiration is 18, which is within normal limits. It is regular, unlabored, or with moderate depth, and his respiration, his lung expansion is symmetric on both sides. Next, I would look at his AP. By doing that, I would take the width between anterior and posterior, and then take that and measure it to be about, for him, half of his chest. So that would be normal, and his AP would be 1 to 2. Now I'm going to have you sit up. I'm going to listen to his lung sounds. And then also check to make sure he has no skin breakdown. Is it okay if I push it up? Thank you. Skin breakdown. Okay. You put your arms down. I'm going to check your back. Thank you. On the back, you would want to look at his shoulders, the back of his head, his scapulas, and then his ribs. And no places that I looked at are red or have skin breakdown present. At this time, I'm going to listen to your lungs. Can you kind of turn a little bit towards me, please? Thank you. Okay. Can you take a deep breath in and out? Thank you. There you go. Okay. Now I'm going to do your back. Okay. Take a deep breath. And then I'm going to have you lift your arm up, put it on your head. Thank you. Thank you. Do that to the other side. Okay. Thank you. Okay. Can you lay back down? His lungs sounds are clear in all fields. Next, we are going to listen to the heart. I'm going to take your pulse. Okay. So his heart rate, his pulse is 60 beats per minute, which is normal. So now I would listen to his heart. We would start at the aortic, which is at the second intercostal, at the right sternal border. Okay. His heart rate is approximately 60 beats per minute, with no murmurs, rubs, or splits present. And at this time, I would correlate the S1 at the aortic to the S1 at the carotid. Can you turn your head just a little? Which they do correlate between the aortic and the carotid S1. Next, I would go over to the pulmonic, which is at the left sternal border. The aortic, sorry about this, is S1 is quieter than S2. At the pulmonic, the S2 is louder than S1. The heart rate is approximately 60 beats per minute, and there is no murmurs, rubs, or splits. Next, I would go down to the third intercostal on the left sternal border, and that would be the orbs. At the orbs, S1 and S2 are equal. It is approximately 60 beats per minute, and there is no murmurs, rubs, or splits. Then I would go down to the fifth intercostal, and that would be the tricuspid. At the tricuspid now, the S1 is louder than the S2, and the heart rate is about 60 beats per minute. And there's no murmurs or rubs. Then I would, and it is on the left sternal border. Then I would go to the mitral, and that is on the left mid-clavicular line. That's your mitral. Your mitral, S1 is louder than S2, and there is heart rate is about approximately 60 beats per minute, and there is no murmurs, rubs, or gallops. Then I would go back through, and I would do it with the bell. And at the apex, I'm going to flip it back to the diaphragm, and I would listen for 1 minute. Okay. So his heartbeat is at the mitral is 60 beats per minute, which is within normal range. Next, I am going to assess his upper extremities. I'm going to lift up your sleeve, if that's okay. I'm going to take his blood pressure. So, to make sure that this is the right cuff, you would do the 40-80 rule. So, you would make sure that it's around 40, right, and it's about 80% length of his arm. And so, for him, this is a good fit, and so he would be in an adult size blood pressure cuff. Can you flip your arm? Thank you. There you go. And then we're going to do a two-step, so I would take the radial pulse and listen and pump this up until I can no longer hear it. Okay. So I can no longer hear it at 100, so I would put it at 130. I'm going to clip this to you if that's okay. Okay. So his blood pressure was 100/50. Oops, sorry, that's attached to you. Which is low. Do you normally have low blood pressure?
Yes.
Okay. So I would go into his records, make sure that that is a baseline. If not, then I would probably redo it again in a little bit. Okay. Now we're gonna his arms. So his arms are warm, tan with pink undertones, a little bit white, showing at the upper half of above his elbows. His skin is dry and intact with no bruises or lesions present. I'm going to assess the capillaries. Okay. His capillary refills in his upper extremities bilaterally are brisk and are less than 3 seconds. And no clubbing is present on either hand. Next, I'm going to listen to his brachial, radial, and ulnar. Put this arm up real quick, sorry. Okay. His brachial pulse is a +2 out of 3 bilaterally in his upper extremities. Then I'm going to listen to your radial. His radial pulse is a +2 out of 3 bilaterally in his upper extremities. And to your ulnar. His ulnar is a +2 out of 3 bilaterally in his upper extremities. Okay, you're good to put those down. Next, I'm going to, grip strength. Then I'm going to assess his grip strength. Here's my hands. Pull towards you. Push towards me. Thank you. So his grip strength is a 5 out of 5 bilaterally in his upper extremities. Okay. Next, we are going to assess his abdomen. Is it okay if I pull up your shirt?
Yes.
Okay. I'm going to look at it. Okay. His abdomen is round, symmetric, and non-distended. so bowel sounds are heard in all 4 quadrants with different frequency, pitch, and consistency. Next, I'm going to feel on your abdomen. Just let me know if you have any pain anywhere.
No. 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 No.
Okay. So he has no pain with like touch. His abdomen is soft, non-tender to light palpitation. There you go. Next, we're going to look at his lower extremities. Can I take off your socks?
Yes.
Okay. Pull your shorts up, that's okay? Thank you. Okay. So his lower extremities are tan with the pink undertone. A little bit above his knees are white. They're warm, besides his knees bilaterally and his feet that are cold and clammy. So they are warm, intact, dry, with no lesions or bruises present. Then I'm going to look behind his knees. You see, lift your leg. Thank you. Lift your other leg. Okay. So he has no redness or skin breakdown behind his knees, ankles, or heels. Next, I'm going to check his capillary refills. His capillary refills bilaterally in his lower extremities are brisk and are less than 3 seconds, and there is no clubbing present. Now I'm going to assess for edema. Okay, there's no edema present bilaterally in his lower extremities. Then I'm going to feel for his dorsalis pedis, pulse, his post-tibial, and his femoral arteries. Feet on just a little. Thank you. Okay. His dorsalis pedis pulse is a +2 out of 3 bilaterally in his lower extremities. And then his post-tibial pulse is a +2 out of 3 bilaterally in his lower extremities. Then I'm going to feel for his femoral. I would do that by having bend your knee in, please. I'm gonna put your foot right there. So then I would find his hip, which is right here, and then feel for the femoral artery. So the femoral artery is a +2 out of 3 on his left side. Then we're going to put your leg down. Do the same to your right leg. Thank you. You want to scoot my way just a little bit? There we go. So then again, I would find his hip and then feel for his femoral artery. His femoral artery is a +2 out of 3 on his right side. So his femoral artery is a +2 out of 3 bilaterally in his lower extremities. Okay, you're good to extend your leg out. There you go. Then we're going to assess your grip strength. Can you push your feet down? Thank you. Push your feet up. There you go. Lift your leg up. And then down. Thank you. Leg up. And down. Okay, so his grip strength is a 5 out of 5 bilaterally in his lower extremities. And then we are going to use light touch. And if you were able to feel this on your lower extremities, just answer with a yes, please.
Okay. Yes, 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 yes.
Okay. So he's able to feel bilaterally in his lower extremities, light touch, and no numbness is present. So at this time, this concludes my PA assessment. Do you have any questions at all?
No.
Okay. I'll come back and check on you later and see how you're doing. Okay. Thank you.